But the context of the engagement between Microsoft and KPMG is that we all want to live healthier, happier, longer lives, and we want our public services to help us with our health and well-being and treat us when we're sick. The challenge we've got is that we're all living longer, and we're living longer with multiple long-term conditions which are stressing the healthcare system, and that's a global challenge. Microsoft and KPMG work together as part of our Care System Redesign programme, which is an international initiative looking to try and improve the way that care services are provided all around the world.
We've been working with them for the last 18 months to really leverage the capability within Microsoft in big data and analytics within Azure. So we spent quite a lot of time with Cortana Intelligence Suite, really helping them deliver new applications or existing applications, but in Azure.
So what KPMG are trying to do in this particular case is to understand the resource issues affecting the NHS, where to best provide resources to mitigate inefficiencies by understanding and planning better against the huge amounts of data we've got. And the problem for them, and for us, is that the data isn't just inside the NHS, it's in social services and other places. And the challenge is to bring that together in a secure way without having anything that's personally identifiable in there.
One of the most successful aspects of the engagement between Microsoft and KPMG was the Hack Day that we held. And that was particularly effective because we had a range of skills from KPMG, a range of skills from Microsoft. We were able to sit down with the common goal of figuring out how to link all the technology together and design a solution that was going to be transformative, not just for healthcare and KPMG in the UK, but on an international basis. And what Microsoft brought was a team of really enthusiastic and very skilled people who actually got what we were trying to achieve from a healthcare perspective. And they were able to work with our data scientists, our management consultants who are experts in transforming healthcare, so that what we produced was actually genuinely usable in the workplace.
One of the main impacts in this project was actually taking this fantastic data pipeline that KPMG had built around advanced analytics, big data, security of data, etc., and actually being able to produce some kind of visualization for the end customer. We did that by looking at Power BI embedded specifically. Now KPMG, their team were Microsoft developers, they used C#.net, so we were able to use the SDKs to actually embed an iframe inside their application and allow their customers to see these insights.
As an international firm, KPMG has to scale solutions like this. And so the way we scale our work is to think about a number of things. The first thing is we have to have a truly scalable, flexible, robust platform that's on when we need it and off when we don't need it. And that's obviously something that Microsoft helped us quite a lot with. The second thing is the methodology that we used in building our cloud analytics platform. And the third thing is the knowledge that we were able to build into that platform from our management consulting teams. And so what we've done now, having created that, is taken it around a commonwealth of countries who face similar problems to those we face in the UK. So you'll see our dashboards powering engagements in Canada and in Sweden, for example.
For me, data science isn't about, and big data isn't necessarily about big data. It's about the techniques that we use. And we were able to, in a couple of days, to be able to take disparate sets of data, bring them together, come up with some analysis, some evidence-based scientific analysis on which we can make decisions. So I think everybody can benefit from a bit of science in their data.